Today's healthcare in the U.S. is broken is brought to you by Cindy Rubin, breastfeeding medicine specialist and fourth trimester doc in the Chicagoland area. Healthcare in the U.S. is broken. It's such a vicious cycle. So physicians cannot themselves determine how much they are going to be paid for their services. So they have to contract with insurance companies. The insurance companies decide how much that doctor is going to get paid. And those reimbursements to physicians have been going down over the years and certainly have not been increasing with inflation. So over time, as the cost of living has gone up and as the cost of practicing medicine has gone up, doctors have had to see more and more patients just to be able to survive and keep seeing patients. And yes, physicians have to get paid, right? Have to make a living. And in order for them to be able to continue to provide the services that they provide. So doctors start seeing more and more patients. They have to spend less and less time with patients because they are forced to see more patients. Patients get frustrated that they have so very little time. Doctors get frustrated because they don't feel like they're practicing medicine well. And they are burnt out from the system and not having enough time with their family because they're always at work because they have to see so many more patients. And the costs of healthcare keep going up and up and up because in order to make this system in any way work or function, like a physician doesn't have time to do all of the back and forth and denials and billing and everything that has to happen. So they have to hire a biller to deal with this. And then the insurance company has so many administrative costs in terms of getting claims and sending out reimbursements and determining what should be covered and what shouldn't be covered. And people get denials every single day. Physicians get burnt out because they have to jump through all of these hoops to get things covered for their patients. It's just back and forth. Nobody's happy. The patients aren't happy. The physicians aren't happy. And ultimately, the insurance companies are the only ones who are happy because it's their bottom line. And they're the ones, those in the C-suite, are taking home that money at the end of the day. They are for-profit companies, by and large, insurance companies, and they are profiting off of you thinking that you need them. You don't need them. You can pay your doctor directly. You can choose who you want to go to. You don't have to just go to their list of doctors. You can do cash pay physician visits. You can do cash pay labs. You can do cash pay imaging. You can even do cash pay surgery. And it ends up being cheaper than using your insurance. Not in every single situation. And it's important to have insurance, at least catastrophic insurance for huge cost emergencies. But for most routine healthcare, you could get it done in other ways, paying out of pocket, and it could end up being cheaper than using your insurance. But nobody knows this. And even those of us who know it get caught in this cycle as well and feel like we're paying into our insurance, so we should be using it, and end up paying more to use our insurance than to not use our insurance. And it doesn't make sense. And I feel bad for all of us caught in this cycle.